I will try to briefly explain a little bit the CitiObs project, that is the one hosting these dialogues. And as you can see already in the title of our project, we were aiming at enhancing observatories for also health and sustainable, resilient and inclusive cities. But health has always been in one of the pillars for what are we doing this project. Next slide, please. So our project deals with citizen science, citizen observatories, and how we can use the data that they are already collecting many valuable data, how we can strengthen the uptake of this data for observation systems, but also on policy decisions in science in order to achieve what we were saying, these healthy and resilient and sustainable cities. Next slide. So Christina?
Yeah, I don't know why it's not moving.
Oh, it's not passing? Okay, no worries. So you can click several times. So the way we were working, it's in this kind of like this circle you see, where we have engagement of citizens and communities that are collecting knowledge, working with local knowledge, with data, with sensors, producing this evidence that then scientists or data aggregators can collect, right, and then can display, providing not only data but knowledge that can then be uptaken by policy and decision makers to get decisions, and again go back to the communities, right, like those decisions. But also in our project, we saw not only two lines of getting decisions, but also like policy decisions and what we call like citizen-led actions or community-led actions. Those are also decisions that the communities can do on their own to protect the environment. Next slide, please. In order to do that, the project is always having this socio-technical methodology where we work with social dimensions as technical dimensions, because citizen science and citizens observatories are more than collecting data. It's also working with people, working with trust, working in relational models, and also on engagement to create more awareness and action. So we have always these two sides in our project. Next slide. Yeah. So what we are jumping to what we are producing in our project, as now we are in our last year of the project. Some of the things we have produced, and you can check in our website, are toolkits to work with the community, and we have toolkits that go more in the social aspects, as like the Leave No One Behind toolkit, creating engagement and inclusive engagement and equity, or the participation dynamics toolkit that works about how to strengthen and build strong relations with the different stakeholders that bring in an observatory, like citizens, policymakers, researchers, sometimes industry, etc. But also other toolkits that go into the monitoring, how to plan and design a campaign, and also the citizen-led action toolkit that shows how you can work together with creatives and artists to enhance your observatory. Next slide. But also, citizen observatories are about data and technological challenges. And here we work to some of the things that we observe are more of a challenge in the observatories today, especially when we want to take them from local observatories that work in their neighborhood, in their city, for their local objectives. We want to use this data more into an ecosystem of European or global data. Then we need to work with pipelines and taglines, like on interoperability, that we use common APIs, standard APIs, but also on the validation of the data, what we call like creating analysis-ready data, that data of known certainty that others actors can use, but also creating already decision-ready information, that is information that we merge the data from observatories with other available data that can be just uptaken by people that don't want to work directly with the data, right? Like we want to foster the engagement and uptake of data and all the different levels, from people that work with citizen science, also from people that do not work with citizen science but could make use of the data. Next slide, please. This is at the European level, and my colleagues will explain more about this, but I wanted to show these pictures. You can click other 2 times if you want, where you can see, like in Europe, we have so many reference stations, but still there are like the possibility with local sensors you see on the top, right? Like with red and yellow, 2 big communities, sensor dot community and purple air. We can also get more data coming. And this is especially true also when we work outside Europe in other of the development or low and middle income countries. So my colleagues will talk more about how we quality control the data and how we integrate the observations with other available observations in order to produce data that can be uptaken by others. Next slide. And also we produce tools that the observatories themselves can use to analyze their own data for their own local objectives. Yeah. We had 3 phases with working with Frontrunner, with Alliance, and with fellow cases. So at the end, now in the project, we are working with 85 citizen observatories, more than 85 citizen observatories distributed around the world. So we had these front runners, and now you can click again. You will see the fellow cases where we open around the world, as I was saying. Next slide, please. Also, very important for us is creating communities of practice, and here you have some of the communities of practice where CitiObs is very, very active, and also communities of practice that you can join, where you will find other observatories and practitioners to share experiences. And also, like what you can find our toolkits, our algorithms, also in the CitiObs knowledge platform, but also on our YouTube channel, you will find also recordings of some of the workshops and webinars that we have been giving, like this one. Next. So this is some pictures from activities that we have done online and in person, and we hope to see you also in more of the in-person and online activities that will come after this one. So thank you everyone for joining us, and this is my last slide. Thank you.
Thank you so much, Nuria, for this introduction. Now you all have a better idea of what CitiObs is as a project and why we wanted to host a conversation like this with you. So we're going to move into the second part of the first block of this presentation, where we're going to hear a bit more technical details from our 3 presenters. We have Aline Verhoeven from the National Institutes of Public Health and Environment of the Netherlands, Philip Schneider also from NILU, colleague of Nuria, and David Rallian from Air Sentinels, who is going to talk about wearable sensors. But we're going to keep the order that I just mentioned. So I'm going to hand over first to you, Eline. You want me to share your presentation, right?
Yes, thank you.
So let me get that up and running. Presentation mode.
Good morning, everyone. My name is Eline, and I work in the Netherlands at the National Institute for Public Health and the Environment. So air quality is at the core of our institute. Because this dialogue today is especially about the link between air quality and health and also citizen science, I'm going to introduce this a little bit. Next slide. And many of you may work on the topic of air quality and health, so it's not new that good air quality is essential also for public health. But because the audience is also so diverse, I thought it would be good to introduce this a little bit. Next slide. And one story that really makes it very clear, this link between air quality and health, is the story of Ella. She was a 9-year-old girl, and she died also from severe asthma. And she lived in London in a very busy area, and it was found that every time she was hospitalized, there was also a lot of air pollution, so it was directly related. And this is the first, and as far as I know, also only person with air pollution officially listed as a cause of death. Next slide. But of course, this is not the only story, and air quality has a lot of impact, a lot of health effects, and also it's seen as the largest environmental health risk in Europe, because also it has effects on so many parts of the body. The smaller the particle, the deeper it goes into the body, and causing a lot of different health effects, and especially also this particulate matter is important. And also it's important that those health effects are not equally distributed. It's across regions, it's different, but also across population groups. For example, children, but also elderly are especially vulnerable. Next slide. And this is also the reason why there is a lot of policies. For example, in the EU, this is the Air Quality Directive, and they have set some limit values for particulate matter. This is also going to change to even stricter limit values. And also this directive states how each member state should monitor air quality and how we should measure. And my institute is doing this for the Netherlands. And yeah, so already throughout all the years, a lot is being done to improve air quality, and also the amount of premature deaths have decreased, but we are still working on it to do more. Next slide. And not only my institute and other institutes are monitoring air quality, but also many citizens started monitoring air quality, and some already for 10 years. And by this, they ask a lot of questions to us, to others, to the politicians, and by that they raise a lot of awareness and also put our air quality on the political agenda. Next slide. And I wanted to show you a little bit how that looks like using some pictures. So here you see some of the sensor kits that citizens are using to monitor air quality. And they can be built yourself, they can be bought, they can be put on your bike or put in your garden. Everything is happening. And also they are, you can see them, like Nuria already said, on the CitiObs maps, but also there are other maps where you can see them. And already from one organization, Sensor Community, there are already 9,000 of those sensor kits in Europe. Next slide. But it's not only data that is part of citizen science, it's also the part where we meet together, we discuss, and people analyze the results together, and have a very valuable dialogue about how air quality and health are related and how important air quality is. Next slide. So I think citizen science is very valuable. It's a complementary network, complementary to the official monitoring with high time resolution and higher spatial resolution. pollution, and also the next presentations will talk about that. But also it creates a lot of awareness among citizens about air pollution and its health effects. But also we learn a lot from the citizens. I think wood, at least in the Netherlands, wood burning is high on the political agenda, also because of the questions of citizens. And also when we collaborate in our research with citizens, the research questions become more societally relevant. Next slide. So I think we in the institutes can think about how we can and also should make use of that we have those 10,000 extra advocates for healthier air. And I want to conclude also by this. Thank you.
Thank you so much, Eline. That's a great introduction to linking those topics, and also for people who might be new to citizen science to really get an idea of what that looks like, no, in practice, collecting data from citizens and making them lobbyists, like you were saying. So, because we have one shared objective is to have a cleaner air and healthier people,
Yes.
right?
Mm-hmm.
So then we're going to jump into a presentation on actually how can researchers help to structure and validate and work with the data that citizens are collecting. So I hand the floor to you, Pip.
Yeah, thank you, Stina. And my instinct is to say good morning, everybody, but I think this is really the wrong thing to say because I see we have a lot of people from all over the world. So hello, everybody. It's great to see so many interested people here today. What I want to show you a little bit is to say about how validated citizen-generated data can be used for mapping air quality. This is one of the obvious but not the only application of citizen-generated data. And this is obviously a collaboration with several different colleagues. Now, Elina has already given a great introduction why air pollution matters, so I don't have to repeat any of this other than saying air pollution obviously is a health issue. I'm preaching to the choir here, but what I'm going to mention is that exposure is also a geography issue. You see here on the map on the left how much particulate matter varies throughout Europe, even on very local scales. And in addition to geography, it's also a matter of activity. And this is something that we'll see in the next presentation by David about how activity level matters. But I will focus here today on the where how does geography matter, how can we use citizen science data to map air quality. Now, as a simple example on the availability of data, I'm showing you a map here from an area in Western Germany, and all the blue dots are official monitoring sites. The official monitoring is essential. It provides the backbone for all regulatory monitoring in Europe. These are high quality, trusted measurements, but they can be a bit sparse. So you see definitely areas here on the map that have basically no official reference monitoring. Now, if you overlay what is available from citizen science observation, you get something like this. So all the orange, each of these orange dots represents one, usually a sensor that measures particulate matter. And you can see how much denser that information is, right? And especially in the cities, but even between cities, we have quite a bit of information. Now, this is, of course, the best case scenario, and we don't use all of that information, and I will talk about this in a little bit. I will continue here. So this is just basically a comparison of what we have available from regulatory monitoring station versus what we have from low-cost sensors. Now, if you look at the European scale, it looks something like this. We have even more observations from these two networks that we mostly look at, which is Sensor Community and Purple Air. We have about 38,000 unique locations. Now, mind you, not all of these measure at the same time. Some of them measured a couple of years ago, some of them measure now, but we have a very large number of observations. In total, in our data set, we have about 13 billion observations. As you can see, it's not equally distributed. We have a sort of tendency mostly in Central Europe, where these, or at least the Sensor Community Network originated primarily. But even outside of Central Europe, we have good coverage in the cities, which is what we're most interested in. Now, We don't use all of the observations, as I mentioned before. And one of the reasons for this is we do quality control. This is absolutely crucial. This citizen science data can be problematic in terms of both the sensor quality, but also because we don't know exactly where people place the sensors. So there can be some issues there. So what we do is we use an approach called filter. And this was developed by my colleagues Amir and Vasilis. And it's a remote quality control and calibration approach. So essentially, we don't need to do anything with the sensors themselves. We just use the data, and based on the data itself and their location, we can sort of make some assumption on what data is feasible, what is not. We go through these different processing levels and different quality flags. And with each of the levels that you see here, from raw output to spatial correlation, spatial similarity, and so on, we reduce the error of the sensors somewhat. And this is very crucial. And we really throw out, at the highest processing level, we throw roughly about half of the observations, but we still have a lot left. Now then, how do we continue with this? Well, we want to make use of that information somehow to generate maps. And what we use primarily currently is a model called SMesh. It's doing a simultaneous bias correction and a downscaling of the COMS regional ensemble. Now, for those who are not familiar, COMS is the Copernicus Atmosphere Monitoring Service, and it provides forecasts of air quality in Europe and globally at about, well, in Europe, about 10-kilometer resolution, globally about 40-kilometer resolution. So this is very coarse for using it at the local scale. But we use that as a sort of a baseline, as a foundation, and then we use additional information from meteorology, population density, satellite observed aerosol optical depth, land cover, topography, and so on. And now the new thing is also sensor observations. We feed all this into a machine learning model, and our output is then a higher resolution, 1 kilometer scale spatial resolution map of PM2.5 that improves upon the summer statistics of just the COMS regional forecast on its own. If you're interested, there's the paper linked at the bottom. And just to talk a little bit about the quality, we have 3 different approaches. One is where we use only reference stations. So there's no low-cost sensors, no citizen science involved here at all on the left-hand side. Then we have one approach where we only use citizen-generated data, and we use that for training the model instead of the reference stations, just to see how that would work, because that could be relevant in areas where we don't have a strong monitoring network. And the last approach, we call that LCSI, is we use reference stations for the training of the model and the citizen-generated data as the input to the model. And this last approach, LCSI, by far is the best approach, and it improves the accuracy of our baseline by 15 to 20%. So you can see here that in the summary statistics that R square is highest of all of them, the mean bias is relatively low, and the mean absolute error is also the lowest of all 3 approaches. And so the idea is that these more accurate PM2.5 maps can better support exposure assessment and targeted action. Just a couple of maps as an example. We focus here on this area in Central Europe, so I apologize for not marking this better, but we have here Germany on the left-hand side and Poland here on the right-hand side. And you can see that on the top left, we have the COMS reanalysis, which is sort of the gold standard of air quality monitoring at the European scale. And then we have our 3 approaches. And just focusing here on the last one, LCSI, we can see that it corrects the COMS output quite a bit. And it does so in a manner that sort of cuts the error rate of the reanalysis roughly in half. So this was quite a nice outcome, and it also improves upon our baseline, and that's really the impact of the low-cost sensor information. All the difference you see here between the baseline and the LCSI approach, this is something that comes directly from the sensor information. At the end, I wanted to show one example of a bit more local scale. We also do sensor model fusion for individual cities, for very local scale applications. What you see here on the map is an example of a very small town in Norway called Kristiansand, where we have multiple sensor available, and we have also a high resolution air quality model, which you see here in the background. And when we fuse these 2 data sets together, we can provide an improved analysis here on the bottom left, which also shows sort of things that were not available in the original air pollution map. So we corrected this in a manner that improves the map overall. So In a summary, we want to complement the regular monitoring data, not replace it with the citizen science data. We want to validate this. So the value of the citizen observations really is not that we just get more data by itself. It is that we can validate this data and then integrate it with trusted systems. And integrating this can be done by using machine learning, but we also use other approaches like data assimilation. And it significantly improves the European scale PM 2.5 maps, but also local map that we look at as well. But in the end, I always say, well, use responsibly, because the citizen science data, especially for health and policy applications, still requires a lot of transparency about the data quality and about the uncertainty of the underlying methods. So everything should be open, the algorithms and the methods and the data in the end. Okay, so just a few acknowledgements besides CitiObs, a few other projects, and of course, many thanks to all the volunteers from Sensor Community and Purple Air who provided their data. And if you are interested in more information, please just come contact me or have a look at some of the papers that are listed here. Thank you.
Thank you so much, Philip. Please leave that on for a few moments in case someone is out with their phone scanning. And we can, of course, share the references in the follow-up communication as well. So thanks a lot for your presentation. Again, if anyone has questions, you may post them in the chat. We will continue with the next speaker, but we can come back if any questions come up along the way. So David, I hand it to you to go zoom into the people level.
Yeah.
Say.
Yeah. Hello. So I hope you hear me well and my screen is on. And yeah, I think it's very interesting to have this presentation left up to Philippe, because we really understand how important it is to have denser information to really understand people's exposure. And we really see the impact of citizen science to really get denser network to monitor that air. The thing is, what we're going to see in this presentation is how wearables, so I guess you're all aware about what wearables are. It's just those objects you can carry along with you to measure your exposure throughout the day. And just had a few numbers I wanted to share, because we're talking about health. So you know that 10,000 is roughly the amount of air we breathe, the number of liters of air we breathe per day. And as it was mentioned, that air, when it's of poor quality, unfortunately leads to quite a huge amount of premature death. And just for France, this cost 100 billion, which is about 3% of our GDP, just for France, because of the impact of that poor air quality. So really understand that beyond just health issues, it also has economical impacts that we really need to address because it's so big. So it's a heavy burden. And as we just saw, we have those reference instruments, satellite imagery, and citizen science that help us get a better view and downscaling to really understand with more granularity. But what? Any of you, I mean, if you're experts in air quality, are you able to tell where, when, why, and how much pollution you've been breathing today? What was like the dirtiest spot you went through? How long did it last? And how much of pollution did you breathe during that moment? And that's sort of where we're trying, the path we're trying to follow with wearables. Just not get the big map, is get our individual exposure to see how we can change maybe our behaviors to have less pollution in our lungs. So typically, this gentleman smoking in his car, the air he breathed, maybe the forecast today for the air outdoor might be perfect, maybe total green, but that gentleman smoking in his car is impacting his health because of his behaviors. Same thing for that gentleman, working outside is generating a lot of pollution for the others, but also for himself. And of course, this has nothing to do with, I could say, air quality, but at the same time, it's also, pollution is breathing and generating, and also, in our everyday lives, that the most dangerous place you can be throughout the day is probably your kitchen, because you have like so many PM and other types of gases that go in those environments. So the thing is, we spend 90% of our time indoors, away from the eyes of those traditional air quality monitoring instruments. And also, that's one limitation when we're trying to evaluate the impact of pollution on our health. And the other thing is that, as we just saw, the main thing we do are maps and they're great, but there's one thing, they tell you where the pollution is. It doesn't tell you why you have pollution and why you've been exposed to that pollution. So this is the idea of, and we'll see, is totally complementary. It's just a limitation. Every tool has its own limitation. And that's the idea with wearables, that we can, go further. So again, our exposure is linked to our activities, not our location. You can be in the dirtiest place. If you have an air purifier, you could be away from that pollution, or you could be a totally clean environment, but have dirty activities and then have a high exposure. So it's of course linked, but not always directly. So, out there are multiple types of objects that can help you monitor your personal exposure over time. This is typically AirBeam. It's a tool that has been there for quite a long time. This is another tool that's AirGradient Go that was launched not long ago. And we also have AtmoTube, all kind of different products. And as you can see, they come in I could say different flavors with screens, no screens, different types of pollutant. They will measure some CO2, some others won't. Some come with an app, some others don't. So it's always a bit complicated to know what's the best tool. But just to let you know that the good thing with wearables is that often they are smaller, mobile, cheaper, but at the same time, they are less accurate because of the quality of the sensors. It's hard to exploit. And that's one of the main limitations, is that you don't have the context of the data, unlike a fixed station. And Philip mentioned that that's one case in citizen science. You don't always know exactly how the sensor has been used. And also it's like more noisier information. So when you look at wearables from the traditional air quality monitoring point of view, it sort of hardly fits, but which is good actually, because even though we're measuring the same pollutants, we're not doing it for the same purpose. In one case, we're doing air quality monitoring. It's generate map, which is so important at global scale. With wearables, you're more trying to measure individual personal exposure. And this is just an example of the kind of outputs you could have. Typically, this is exposure in the subway. And you can see that depending on the station, which is, so you just stay in the same subway, you just go down from one station to the other. And you can see that it's a 1 to 50 exposure difference. So it doesn't explain why you have such a big difference. But with those types of sensors, you can really see super impacted situations that you could not see with traditional equipment. Also, this is like from personal experience with almost 300,000 points of measurements. I can see that I'm responsible of about 80% of the pollution I breathe every day because of what I do, because we spend time indoors, and indoors, you can see that you have quite, activities like cooking, DIY, and even cycling, that's outdoor. But you can see that most of our indoor activities generate a lot of pollution. So this means that by changing a few things in our behaviors, we can remove a lot of that pollution. So wearables, the main limitation is that, as I mentioned earlier, you need to add the context. As you say, as you know, that we say data without context is noise. And when you have wearables, that generates a lot of noise if you don't bring that context. So that's like the extra step. And that's one of the main limitations of those technologies. And also, as you mentioned, if you're working in regulation, it's hard to get global insights just from So at some point, it's hard to extrapolate. At the same time, the good thing with wearables is that you quickly, again, as a person, as an individual, you quickly understand where your exposure comes from. And you can see that most of the time, it's easy to limit some of it. And typically what we do is that just tell people, while you cook, open your windows or have indoor activities, and you can see that you can decrease by a lot. And the good thing is that with wearables, you can actually quantify and say how much of that pollution you have removed from your exposure by changing those few things. So that's perfect, because it means that you turn from a passive victim, say, hey, I can't do anything, I just have to breathe. And you become actor of the air you breathe. So I think this is why wearables, again, have so many limitations, because they don't fit in the traditional air quality monitoring value chain. But at the same time, when you want to give people a better understanding of their exposure and where that exposure comes from, it makes them actor of the air they breathe. That's why it's so complementary. So we have the reference that's citizen generated, and I think that the wearables are part of the equation. So it's not one versus the other, it's one with the other, and each have their weakness and strength. And that's just a final sentence I like to point out is just, air quality maps tell you the weather, and the wearables will tell you if you're standing or not in the rain, or if you got wet in the shower, because that means that even by your own activity, you could expose yourself. So that's, again, the idea is to see how we can combine all those technologies to help people better understand their exposure and limit their exposure and the impacts on their health. Thanks a lot for your attention.
Thank you so much, David. We've had now 3 very complementary pictures from National Agency for Research Institute and from a company who is really focusing on helping people understand how their daily habits can impact their health and try to address that. I saw that we have a question in the chat on if we will be sending the recording. We will put it on our YouTube channel. So this will be a good moment to promote it. Maybe I can ask Panagiotta if you can share the link in the chat so people can subscribe already. So before we move into the next block, which is where we have our special invited guests for the roundtable, I just wanted to take a moment because we have over 50 people in this meeting and from around the world, as we were already commenting. So let's take a moment to just check a little bit which type of organizations and people we have here in the room. So if you can go to the Slido, I am going to start just to take a check on what type of organizations you here today represent. And I have seen that we also have some of our cases here in the audience from citizen observatories. See, scroll down here to get all the options. A lot of academia and research, civil society organizations. We have 24 people responding so far. Grassroots initiative, a little bit from every. Great, we have a clear winner for the session today. Representatives from academia and research, but also civil society, which is great to see that we have also some citizen scientists, hopefully, in the room. And the next question is, now that you have listened to our framing presentations, what does citizen science mean to you in one word? This is a very difficult ask. But just to see what you have felt inspired by this morning. Wow, that's a nice starting word. A lot of insights. Involvement. Yeah, I think it's nice that we highlight always this double aspect, that it's about the data and it's about analyzing the data, but it's also a lot about the involvement. Thank you for participating in the poll. And now we are going to move into the second block of the session today, which is our roundtable, where we have invited some organizations that are working on the intersection of air quality and health, and some of whom have some experience in citizen science, and others maybe not so much, but that's the point of this dialogue, that we would like to put these two worlds together and try to see what opportunities that we can identify here together. So we have hopefully with us here, I cannot see everyone at the moment, but we should have Thomas Cole Hunter here. Are you here, Tom?
Yes, I am.
Great. So the way that this is going to work is that you will all have around 5 minutes to be able to share what your organization and yourself are working on. What's your important mission when it comes to air quality and health? What are some challenges that you are tackling? And then we're going to have a little bit of a discussion. So Thomas, you are Director of Biosciences of Public Health at the European Academy's Science Advisory Council. And you wear different hats as well. You also work as a technical expert in environmental health at UNICEF, and you're a researcher at Copenhagen University, right? So
Yes.
From that perspective, we look forward to hear your perspective and about your work here today.
Okay, I'm straight up. Okay, great. Thank you, Stina, and thank you all for the opportunity to talk to you very briefly about my perspective on air quality and health, and then I'll try to save most of the time to facilitate the roundtable discussion that we'll have with all the speakers. I will start my presentation. Move it to the other screen. So yeah, as Stina had mentioned, that I kind of wear three hats. I mean, I've been an academic for the last 15 years, and in fact it was working with the project that both Nuria and Philip were on as well, called CitiSense, that Nilu was leading, and it's really nice to see that this work in citizen science around air quality and health is continuing. That's not the right one, but we'll get there. Okay, you can see that now, I think.
Yes.
Yep. Okay, great.
I think presentation mode, not yet, but
it's not presentation mode yet. Okay. Well, I'll continue anyway in the interest of time. It's not so important to see the text, but so yeah, three-hat perspective in air quality and health, but all of those kind of work together to turn air quality evidence, hopefully, into credible action. And I think in the next slide there will be, or at the end of my few minutes, I'd like to prompt the audience to think about what can we do to make evidence more useful or credible for decision making. So for the example given by Alina Verhoeven of Elikissi Deborah, be it true or not, I think it's near the truth that the first and only cause of death by diagnosis from air pollution was this case. And then it's a matter of, well, if we had that then, why have we not had more subsequently, if the data is available, and for sure the advocacy is there. So why is there that gap between the evidence and the action? And I think that would really be important potential political pressure by having these diagnoses around air quality and health. Also, as a prompting question was said by David Rialant, if I'm pronouncing that correctly, around 90% of exposure being indoor and unseen. And then this is a question around, I've kind of learned through my work with UNICEF that we have in a large part of the world that the houses where people are living, they're not electrified, and they might rely on combustion of biomass for energy needs. And it would be a question then to the CitiObs consortium or other partners or developers in this audience around, is there anything in the pipeline for procurement that UNICEF could use potentially to go in and collect this data in these environments? So yeah, the ESAC hat is the translation of evidence to policy. We haven't had any reports yet on air quality and health. Unfortunately, that's something I would love to lead, but it's more a matter of decisions made and interest from the steering panel members that we have that are nominated by the academies around Europe. with UNICEF, as I mentioned already, it's around procurement of devices and lab services, but at the moment we're looking at lead. However, there is a parallel program running by the Environment and Health Program that is looking specifically at air quality and health, and of course this is focusing on children and largely in the lower to middle income countries around the world. And then still keeping one foot in the research arena with being a guest researcher at University of Copenhagen. And while not so much doing citizen science work there, doing real world experiments with what you might call microsensors, which I think are being developed still with CitiObs, and that was something that we were doing in the CitiSense project previously. So I think I'll just skip to the next slide and show this checklist that I kind of thought of and made up, and I think is relevant for both policy application and research, or really you could probably flip that in that chain of, I guess, feeding the evidence into policy. So firstly, making fit for purpose use case, being clear whether the data supports awareness, hotspot detection, advocacy, intervention design, evaluation, or policy dialogue. Secondly, quality and transparency. So methods, calibration or co-location, metadata, uncertainty, and limitations should be visible and understandable. This was a really important point for a couple of small projects we did for the municipality of Copenhagen, in which they wanted to know air quality in different microenvironments, namely bicycling paths or green paths running through the city, but they also had interest in neighborhoods near the airport. And for them, it was really important that we had this quality and transparency within the report for the data that we collected so that they can then have defensibility of their actions taken based on this evidence for the citizens. Thirdly, then on this checklist is exposure and health relevance. So the data should connect to where people spend time, who is exposed, and why that exposure matters for health. Fourthly, policy and stakeholder usability. So having the data translated in a way that's easy for people that are not technical, that might be in the policy realm, for them to understand. And then finally, a route to action. So if there's a plausible pathway from evidence to response, whether in research, advocacy, child health, or urban policy. So it's great that we can collect this data and form that into a message that X leads to Y, but I think it's also important that we potentially study interventions. So under the academic cap, I spent a couple of years in Colorado, and there we did a human-controlled exposure study to cook stove emissions and health. And we tried to then see, with these interventions that were happening around the world with clean cook stoves, where some of these cook stoves are better able to reduce impacts on health compared to other technologies that might have been rolled out by other interventions. And I think I'll leave it there. That's probably about 5 minutes, but yeah, I guess there will be time for questions potentially later with the roundtable.
Yeah, exactly. Okay. Thank you so much, Tom.
Yeah.
Really good point, really great checklist as well. And I think also some of the things you point out there really fit well with some of the next speakers in the roundtable as well. Okay. So next in line for our roundtable, we have Pallavi Pant, Head of Global Initiatives in the Health Effects Institute. Are you here, Pallavi? I cannot see you at the moment.
Yes, I'm here. Thank you, Stina. Hi, everyone. Really nice to have a very interesting mix of organizations and countries. And just as an introduction, as Stina said, I'm Pallavi Pant and I work at the Health Effects Institute. We are a nonprofit research organization, for those of you that may not know us well. And our focus has been air pollution and health for 45 years. So what we do is really trying to understand the health effects of exposure to air pollution and doing that through a variety of ways. So a lot of what we do is funding research. So it's nice to see academics and researchers represented in the room here, and trying to think about questions in the larger context of air quality and health that are policy relevant, so that the research and the evidence that is coming out is directly used for policy decision making, to set air quality standards, for instance, or to identify different interventions. And then another piece of work, which has been a big component of what HEI or the Health Effects Institute does, is looking at whether the interventions that have been introduced actually resulted in an improvement in air quality or not. So I really like the point that Tom was just making about not just trying to understand what the problem is, but when we do things, does it actually result in improvement and change? Because that can then lead to even more and more effective policy decision making in the future. Another part of what HAI does, and which is what I'm more intimately involved with, is trying to take the air quality and the health data and evidence that already exists, because we do have lots of evidence and understanding on how we get exposed to air pollution, what that means for our health, and where there may be opportunities to reduce exposures and therefore improve air quality and improve health, and make that data and information accessible in a variety of formats, in a variety of languages. So we run an initiative called State of Global Air, which produces a report annually in partnership with the Global Burden of Disease Project to look at how air quality levels around the world are changing. In some places, are we seeing improvements or not? And what that also means for health impacts. In addition, we also try to produce resources that can be used by a variety of organizations, including by civil society organizations, by the media, by governments in some cases, in trying to take, again, very scientific information, but making it more accessible and useful. And in the context of all of this work, citizen-generated data has been of great interest. I think so far, the majority of the work has been in using some of the citizen-generated data and citizen science data in understanding better what the exposures are, where they occur, and what that might mean for health. I think there's still ongoing work in trying to figure out how best we can use some of the citizen science data, especially lots and lots of low-cost air quality monitoring networks that have been deployed in places where we've traditionally not had air quality monitoring. How do we use it to do health studies? So it is an area of active interest, and one where hopefully we can all collectively continue to make further progress. Another interesting piece, and not part of my official role, but something that I have done over many years, has been working with community organizations to think about how best to use data and how to interface that when communicating with others. So similar to what Tom did, I also want to just raise perhaps two or three questions that we can collectively think about. One of which is, it's wonderful to have more data as a scientist. That's what we all always want. But also in generating a lot of this data, thinking about, especially with citizen science projects, if we generate the data, but we don't have the necessary associated information. So for example, if you're able to generate information that tells us, oh, your exposures are really high for most part of the day, and here's all the activities that are, resulting in these high exposures, we really need other information to go with it that can also tell people how to either reduce those exposures, or how best to, work with the government, or to create a conversation for more structured interventions and actions. Because in some instances, what has happened is we start to get more data, which is great. People realize that pollution levels are really high. They're getting exposed to levels that they shouldn't be getting exposed to. And then they feel disenfranchised because there's nothing for them to do. So just trying to think carefully about how we pair the increasing access to data with the right level of information, so that we go to the path that Alina, I think earlier, was taking us on, that we need these people to be lobbying and talking about clean air, not sort of resigning to the fate that we have these higher exposures. And then the other piece also being, there is existing data and information that we can leverage and use, and what are the best ways to combine citizen science efforts with available data, so that we also don't have to necessarily reinvent the wheel all the time, and we can capitalize on what we know from work that has been done both in the research space, but also within community organizations as part of larger projects like CitiObs. So I'm hoping that we can touch on some of these. But thank you again for this opportunity and looking forward to the conversation.
Thank you, and thank you both for already also bringing your questions here. I think that we will have a lot to discuss indeed. So thank you for sharing as well. So next in line now we have Dorian Dorestein. I'm not sure if I pronounced that very well. Senior project manager from Globe Netherlands, with her colleague, or I'm not sure who will be presenting, but you are sharing perspectives together with Jolanda van Rissen, who is Senior Policy Advisor from the Lung Foundation of Netherlands.
Yes.
So,
Jolanda,
Doreen,
you here?
Yes, I'm here. Yes, Doreen will start and then I'll continue.
Great. Would you like to share your own slides, Doreen, or would you like me to share them?
Oh, you can share.
Okay, so let me get them up. I can manage that as well. Yeah.
Yes, great. Perfect. Thank you so much. So hello to all of you. Jolanda and me would like to tell you a bit more about the Sniffer Bike Junior, where pupils will check the air quality with sensors on their bike. So my name is Doreen Dorrestein. I work with Globe Netherlands. Globe is an international organization, a non-profit organization concerning citizen science, nature, and education. Our mission is to raise awareness about the impact of air pollution on health by empowering pupils to explore it themselves. And their data support scientific research and also local policymakers. And we would like to inspire the next generation to contribute to a healthier, cleaner communities.
My name is Jolanda van Rissen. I work at the Dutch Lung Foundation. It's a non-for-profit lung organization for lung health and also a patient organization. We're focused at eliminating lung disease, so no one gets a lung disease, but also we're doing research on how to cure it. We'd like to contribute to a healthier and happier life for people who already have a lung disease and have to live with that. And most importantly for today, we want a world in which everyone can breathe freely. So we're looking into how to promote clean air. And on the next slide, you'll see our joint mission, because we're in this project on children's education about air quality together. And there we want to raise awareness among children and also among their parents, because if the children know about air quality and about health impacts, they will also talk to that about that with the parents, and the total group will get information. And the same route we like to have behavioral change. So children maybe ask their parents, can we go to school not by car today, but by bike or walking? And we want to create a healthier living environment with clean air for everyone. So we start with the children and we hope it will spread. And we have an educational program about this for elementary school children aged 10 to 12. We have a small video which introduces it.
So, let me
and
see.
if it can start at about...
Sorry?
Yeah, if you can start it like 5, 7, about there.
Yeah, here, right.
Great, thanks.
There. Here we go.
Als kinderen nou bewust worden van dat er een belang is bij gezonde lucht en dat je daar zelf ook iets aan kan doen, dan hopen we dat ze de rest van hun leven daar ook rekening mee gaan houden.
Dit is de knuffelfietssensor.
Blauw is goede lucht, oranje is niet hele goede lucht, maar ook niet heel slecht. En rood is echt super slechte lucht. Ik hoop dat we vooral blauw krijgen.
Ik vind het heel leuk en nu weet ik ook dat lucht bij school schoon is.
Vandaag heb ik iets geleerd wat ik nog niet wist, over dat je longen een soort van boom was als je hem onder kop zette. En de zuurstof dat door je longen gaat, uitkomt in je hart en dat gaat via je bloed. Onze longen groeien nog, het is heel belangrijk dat wij bewust zijn met wat we er ook mee doen.
We hopen dat alle scholen in Nederland meedoen met dit programma, want wij vinden het heel erg belangrijk dat kinderen geïnformeerde keuzes kunnen maken over hun eigen gezondheid en over hun eigen lichaam.
So to get awareness on these pupils, it's really hard because air pollution is invisible, and this sensor makes air pollution visible. It has this little light on top. You heard the students talk about that in the video. It can turn blue, light blue, dark blue, yellow, orange, or red. And it's really hands-on experience for them because then they can easily click it on their bike. And while biking, they see the colors. All colors have a specified specific concentration of PM, and afterwards they can go to a website. I will show you later on Know Your Air. So on the left below, you can see the colors right after they have biked with the sensor. And the sensor contains not only a PM sensor, but also a temperature and a humidity sensor, and also a GPS. So the project Yolanda was talking about, so it's for pupils from 10 till 12, and it's within 3 to 4 lessons. The pupils learn about the effect of air quality on your lungs and how do lungs work. And they even have the possibility to invite a lung specialist at school. They learn when is air healthy, when is it unhealthy, how do you measure it. And with the snipper bike, they measure how healthy is the air around their schools. And they end this project with a discussion about what they can do. And not only them, but also their parents and their school to improve air quality. And what's really special, I think, about this project is not only this cooperation between Globe and the Lung Funds, but also we work together with the Dutch Ministry of Infrastructure and Water Management, and also with the local authorities. And they provide the sensors for the schools. And sometimes the pupils present their findings to these policymakers. So within this project, pupils have the opportunity to engage with scientists and also policymakers. As I told you before, they can easily see the data after they have cycled, and that's on knowyourair.net. So it's real-time data. It has all these colors from the PM concentration. It's open source. And for primary schools, they mainly use this data on the Know Your Air. But for secondary schools, where we also have this project, pupils can export the data as a CSV file, and they can make all different graphics with Excel. And all these data of Know Your Air also goes automatically to the RIVM, to Eline Verhoeven and her colleagues. So RIVM can use it to have more information about the PM.
Then a bit about the credible and usability of the generated data. First of all, about the sensor, it's important for us that it keeps developing. So for instance, first there were only 3 different colors of light on the sensor. Now there are more, so the children easily see if it changes around them. Also, the cost and the quality of the measurements, the balance between those is important for us because it can be too expensive, but you do need measurements that you can use for a classroom. And it should also be easy for the sensor to be put on a bike and to work with it. If a teacher needs too much time to do this, then it will not work for children this age. Yeah, and also for the children, it needs to be easy. So when they're biking and they have to wait until they're back to see how air quality is, then it won't work. So it's easy with a light, and they immediately understand what they're doing. And for the data, it's important for us that there's a platform like Doreen just showed, and it gives the data real time. So if half of the class is biking, the other half of the class can follow them and can see how the air quality is at the point where they are. And also when they get back in class, they can immediately see the line on the map. It's quite simple because of the color codes. And like Doreen said, the data can be exported. And we have finally some challenges on the next slide. The most important one is to expand the impact of the project. So we like to have all children in the Netherlands and maybe beyond to be able to learn about air quality in this way. And then it's a challenge to find teachers who have already a very busy schedule to find time for them, and also to make it quite easily for them to run the project. We have a cooperation with nature and sustainability education centers in the Netherlands, so they can help the schools and help the teachers how to use the sensors when they have problems, or give them information, for example, about particulate matter and how it influences lungs. It's important to ensure that the sensors work in a simple and accessible way, like I just said. But also it's important to have partnerships because these sensors are not really expensive, but they do cost money. And we do need like municipalities and other agencies to fund them, so we can give them to all schools, not just the schools who have a budget for it. And finally, the data is important, not just that you can see it on the map, but also that it's used for a bigger purpose to make analysis about air quality more in general than just one route around one school. But that's the challenges we're working on with this project. Thank you very much.
Thank you so much for providing these very nice examples of citizen science in education. We have one more speaker for the roundtable, Celia Garcia Alberto. Are you here with us today? This is actually someone who has agreed to step in a very short notice here because we had one cancellation. We are really happy to have you here, Celia. You come from the health in urban areas field and working on many types of different data to inform urban planning. So we will be happy to hear from you. I cannot see you at the moment, but
yes, I am here. Can you hear me?
Yes.
Yeah. Okay.
I can hear you. I can see you as well.
Okay.
So
nice.
You work for Healthy Cities. I'll let you introduce yourself and your project and what you're going to share with us today.
Okay. Thank you very much, Stina. And good morning or good afternoon, everybody. So yeah, I'm Celia. I'm an architect and urban planner from Healthy Cities. We are a startup based in Barcelona. And well, I've quickly put up a presentation that I might share with you. Yeah, here. Can you see it now?
Yes.
Okay. So the idea of today was introducing the Healthy Cities Generator, which is a digital tool that we've developed for over 10 years, more or less. But before, I wanted to reflect a bit and contribute to this reflection about health and cities. So why do we need, or why do we talk about healthy cities? So the evidence tells us that almost 90% of our health depends on things that are out of the clinical space, such as genetics, behavior, social circumstances, or the environment. So that's why we think that the city should be a tool for health, and the other way. So health should be a tool for urban planning. It's like we like to remind ourselves that just as a safe city is not a city full of police, a healthy city is not a city full of hospitals, right? It's a city that promotes health in a holistic way, right? So it is very simple. This is something that some of the colleagues have reminded before. Planning has an impact on the cities, and planning has an impact on health. And this has also an economic implication because better health means also saving on medical expenses. And here is where the tool comes up. This is a tool that we've developing for over several years with the support of entities such as the WHO, UN Habitat. And the idea of this tool is it is based on scientific evidence because we researched and we looked at literature for many times. The idea is to understand the link between urban planning and health, like the spatial characteristics of the urban environment and different health indicators also, well, from environmental, such as air pollution, noise pollution, etc., to mental and physical indicators. It is very easy to use. It doesn't require complex data. It is also adaptable to different contexts, and the idea is to identify priority actions when you have identified the health needs of a context, and you have analyzed the characteristics of the urban environment, then the tool helps you to identify or prioritize which actions should be addressed in this case to improve the health of citizens. And we can also quantify the impact on not only on health, but also on economic savings. Well, this is where we've worked so far. Well, we implement things from knowledge to more like practical cases, such as health impact assessments, master plans, urban health strategies, etc. Well, these are some of the partners that we've worked with during several years, from public institutions to research entities and private organizations, like at the local, at the Spanish level, but also at the European and more like global level. These are some examples where we've used the tool. This is a case, well, an evaluation that we did for a project in a city next to Barcelona, where we saw that they had increased the green coverage, biking lanes, pedestrian areas, and this had led to a decrease of cardiovascular diseases, depression prevalence, and also the plan could lead to a potential saving of 20 million euros per year, which meant around 218 euros per year per person. And this is all based on a research that we did with the University of Lisbon on the expenses that every country, well, where there was available data, wasted on different diseases, on healthcare costs. Then this is another case that we did for the city of Bradford, where they were implementing a plan for the urban transformation of the center. And here we identified a potential saving of 42 million pounds in this case. And this could also, this helped the municipality to also mobilize funding to keep investing on these kind of projects that had later an impact, a positive impact on health. Then recently we have worked with UN Habitat to develop like quick scans, which are like a basic preliminary health impact assessment for 6 cities in different regions where they work. We did 2 kinds of assessment. One was a baseline assessment, which is the analysis of the urban context, let's say, of urban determinants, which are things like density, mobility, variety, landscape, and housing. And then we also did the assessment of an ongoing plan in the case of the city of Bangkok, to also assess the impact on health of this plan, to see if it was addressing the health needs of the population, and also measure the potential impact on economic savings, which is, well, this band with all these numbers is some of the figures that we came out with. And how it works, how does it work, the Healthy Cities Generator? Well, there are 4 basic steps. So first you analyze the baseline, so the spatial characteristics of the environment. Then you combine this with the health indicators. So let's say the most desfavorable health indicators in the area. And then with this, we get the results about the economic impact and the health impact. And recently, we've also added a citizen engagement module, and this is very related to the discussion of today, because we understood that this was what we were doing so far was more like in a more quantitative way. Many times we do these kind of workshops in different contexts, but we wanted somehow to introduce this perspective into the tool and to systematize somehow also the way we included the citizen experience, right? So we did some workshops to try to understand how to better incorporate this perspective into the tool. And these were some some experiences that we did within a European project, a Horizon project. And well, here you can see also the diagram on below of different groups and the way they were identifying also different different weaknesses and strengths from the context. And we find it super useful to maybe get information about things that probably we are not identifying with our analysis. And this is how it works. It's a user-friendly mobile survey in different languages. And we try to rate the urban determinants of health, which are aspects about density, mobility, variety of services, landscape, and housing within this questionnaire. And then at the end, we give also a score of how healthy their city it is at this moment. Then with the tool, we can also compare profiles, like let's say, for instance, women over 65 years, and with the overall or the average response, so that we can compare also what every collective or every group is rating better or less, right? So this can also give us more precise or accurate idea on how the context is performing. Well, these are other functionalities that we can use within the tool, within this module. We can filter, we can analyze the results in different ways. And this also gives like a political level and professionals and practitioners some more information about the context or the plan. So yeah, that's it. I hope it was clear. It was very fast, but well, you can also visit the tool at the app.healthycities.com, where there is also like a test version, let's say, a free version, where you can also play a bit with the scorings and the health indicators to see how it reacts and which should be the priority actions to address in this case. So thank you very much.
Thank you very much, Celia, for jumping in and sharing this. I think it linked very well to what we were saying about having the data and analyzing it is one thing, and then actually making it very actionable. So maybe to kind of kick off the round of discussion with our roundtable speakers, I wanted to come back a little bit to this question of confidence. You are all working on this interface between policy and research, so science and citizen science, and using evidence in policymaking. So what about organizations and policymakers' confidence in citizen-generated data? What are some of the challenges that you have come across in this, whether citizen-generated data or maybe data and science in general, if you haven't worked specifically with citizen-generated data? So this question goes back to our roundtable speakers, and then I would also like to invite the colleagues from CitiObs and also people from the audience to please also share your questions. Who would like to give a response to this prompt provided by Tom? Or maybe Tom, you open the reflection by yourself.
Sure, I can try to kick things off. So yeah, it was a question of, or with the example given by Elena, that so we had this case in London of a child that had been, cause of death was labeled as due to air quality directly. That was the first case as such. Maybe we need to check if that was the only, but to me that would be surprising. If that is the case, then why is that? Why was it kind of a one-off case? Was it perhaps it was politically driven by an advocacy group, or just perhaps that there was so much media attention that people got overwhelmed, or was there not a pipeline of that same evidence that the what would you say, mortician or whoever it was that provided that cause of death as air quality, was that pipeline not then set up to keep having that information required to make such a claim that there were these deaths, more deaths linked to air quality? We know this is the case, I think, and for sure, Avi would kind of back me up on this, that there's, it's pretty clear that air pollution affects pretty much every part of the body, and is leading to many deaths from different causes. But then why aren't we seeing more of this, these direct links between air quality or air pollution and deaths? What is it about the data that's getting to decision makers potentially, if it is getting there? What is it about that data that maybe isn't getting understood or isn't able to be ready, packaged to be picked up and used for change?
Yeah, I'm happy to add to this. I think a couple of things. So in case of this particular incident with Ella, it really was after after her death, there was an inquest because her mother was convinced that air pollution was, part of the problem, and it had never been something that came up during the entire time that she was suffering from, asthma exacerbations and getting admitted to the hospital. And it is not unique to air pollution. I will also note, like if you think about smoking, it's associated very strongly with lung cancer, but often on a death certificate, you're going to see lung cancer or something related to that as the cause of death, because you're trying to look at, what was the biological reason for the death. But there are many ways that we could try and change that. I think one other just quick example, sort of related to citizen science, but not quite, is that in the aftermath of what happened with Ella, a couple of hospitals in London did start including air quality information in the set of data that is available to the doctors when they're meeting with the patient, so they can also at least give them some guidance on whether air quality tends to be good or not so good, and what that might mean in terms of health. So there are ways to go on that front for sure, and it's great to see also some interaction starting from the very young age. So getting kids involved, I think it's an excellent way to do this. Just in terms of use of citizen science or data, I think I want to maybe highlight a slightly different part of the story as well, which is often, especially in places where no air quality data exists or regulatory grade air quality data may not exist, citizen generated data can sometimes be the first data that comes out, and if it is showing that pollution levels are high, and that then leads to a public demand for cleaner air, it can sometimes result in a backlash as well. We have seen that in at least one or two countries, especially in Asia, that having citizen generated data, especially when it is public and openly available, has then resulted in governments saying people cannot use low-cost sensors, or they cannot put that data out publicly, or it can only be available to, group X or group Y. And I think that in a way that also tells us the power that this type of data can hold, because it can sometimes be the first instance that people are seeing how bad the quality of air is. And that is a definite barrier in many locations, is something for us to be thinking about as well. And then the final quick point I will make is that with citizen science, or even with other types of data, sometimes there is that missing link of how do we take what I'm getting out of an instrument or from a number of instruments that I may have deployed and make it understandable for as many people as possible. So it's great to see the CitiObs toolkits and examples. There's others, like Air Gradient has created a really nice toolkit as well. So we need more tools and resources at that interface too, where I've generated the data and now I want to use it in different ways for different audiences. How do I best do it if I'm not a trained air quality expert? So that may be one other place of collaboration.
Thank you so much, Pallavi. Yolanda, Doreen, or Celia, would you like to add something? And then I will invite also our colleagues from CitiObs if they want to respond. No, not for now. So I don't know if Nuria, I seen you connect back and forth, or Philip or David, if you would like to add anything to this discussion around some of what happens when you produce the citizen science data and try to get it into the pipeline, into policy making and impacting policy decisions, and what can be done.
I always mention, yeah, of course, getting more accurate, denser network of data is so important, but also, and that circles back to what has been said by Elena, just a simple story sometimes tells more than words. Of course, more than data, I mean. Data is super important, but the way our brain works is that wherever you start with data, people will start questioning the data. If you start with a story, then you can empower people will relate, and then you back up with the data. So it's also a way for us, let's say scientists, to put things in the right order to get the message through. And again, focusing on the data is important, but it's just part of a larger story when we need to have people actually feel what we're trying to talk about.
And I think I can relate to, I saw that there was a question coming also from the chat about working together with local authorities and health organizations. So Mohammed Rajput put a very nice question here. How can we make low-cost sensor data credible enough for local authorities and health organizations to use while still keeping citizen science accessible for communities? And I can talk on behalf of the organization that I work for, Eurocities, which is a cities member organization, where there are some barriers for local governments to work with citizen science, because partly maybe what Pallavi was coming at, that it's not their data, and it's hard to sort of get the trust to say, can we rely on this? Is this really accurate enough for us to actually base policy decisions around that? And what are the costs going to be if we need to work on a lot of manipulation and validation techniques with resources that we might not have? So Dorian and Yolanda, you spoke about the importance of partnership with local authorities. Would you be happy to share a bit what that looked like in your context?
Yes, we work not only with primary schools, but also with secondary schools, with local authorities. The best part is that they not only fund the project and the sensors for the schools, but they also reach out to get to be in contact with the students. So the student thinks it really makes impact if they present their results to these people from the local government. So they know they don't only do this research for the teacher or for grade, but they have people they have the same research questions, and they're really interested in how they did it. I think that's really important to get a really high impact of the students, what they're doing. And we've noticed that it really helps if a government have in front a specific area or a specific research question. So pupils do this specific research that makes it more useful for the government. But it's still, hard for local authorities to really use this data, because PM is really hard to measure these local sources. But I think this is the first step, to get them in contact and think of what they really want to know, and that they see the students as that they might help.
Thank you very much. I don't know if any colleague from also the National Institute for Health and Environment, Elina, if you want to share any more insights on this collaboration between authorities and citizen science.
Yeah, so I mentioned we are one of the National Institute monitoring air quality. So we have a lot of this data, and we have a lot of this expertise, but at some point we noticed that apart from us, those citizens are doing it, whether we are involved or not. So we kind of decided, well, let's be part of this movement, because then we can both learn from it, but we also can see what is happening, how we can also add something. For example, we calibrate the sensors. So we just started because it was there. And I think that's very important to see where the opportunities are. And also we try to connect a lot to the different municipalities that are struggling with similar questions. And then we can also try to share the expertise around the Netherlands, but also in those international projects.
Thank you. We had also some questions here coming around the sensors, and we have some challenges related to certifications and licenses required to conduct health impact assessments. I am not sure if I might invite Richard Moraya, if you want to open your microphone and maybe explain your challenges and put the question to our speakers here, so we get a bit of the context that you are working in.
Okay, yes, thank you very much. I hope I'm audible.
Yes.
Oh, okay, thank you. So my name is Richard Muraya from Kenya, and a fellow of CitiObs. One of the key challenges that we face with regards to air quality data in our country specifically is that there's so many individual and sometimes conflicting licensing and registration issues that affect not just the quality of the data, but also the participation of citizen scientists in collecting this data. And like I had mentioned, our National Meteorological Agency now has started the conversation on registering air quality monitors across the country, because they consider air quality data as part of meteorological data. And for you to have your device registered, you have to have it calibrated, an annual license to be paid, amongst many other bureaucratic issues that I'm looking at the moment. So for a citizen science initiative like ours, we have currently about 50 sensors that we are currently deploying across the country. And now when you multiply all this paperwork that is required, even if you have the support of either local or the national government, you find that it becomes a snowball effect where you need so many, you need a lot of paperwork to make sure that your work can be absorbed into national reporting systems. So I just wanted to know whether this is a similar challenge that has been faced by any of the partners, and maybe how to navigate them within your context, so that I can also learn perhaps how we can also adopt that for KCA in Kenya. Thank you.
Thank you so much. I don't know if any of the roundtable speakers have any insights to share here. Otherwise, I would also like to invite Nuria, maybe, if you have any insights on this, or Philip, based on all your work with validating low-cost sensor data.
I can maybe just say a few words on this. I would say we have not faced very similar challenge to this, but that is, it seems to me, because Kenya is quite far ahead of Europe in this context, because in Europe there's not so many agencies that really are sort of seriously considering low-cost sensor data to be in the official monitoring pipeline yet. So this is something we're trying to work towards, but so far there's not so many hoops, at least on the European scale, because we just don't simply consider that so much. There's, for example, no reference agency that says every low-cost sensor air quality measurement has to go through us or it cannot be used. There's no such thing in Europe. And so in that sense, it seems like Kenya is quite far ahead.
Indeed, and again, referring back to the discussions that are taking place in Eurocities, there is a technical specification being developed for sensors to be used in urban spaces, and it looks like there are some similar challenges there, because what I have picked up from our member cities is that from the producer side, this certification looks like it's going to be quite costly and lengthy to carry out. And so there are not enough voluntary users of the specification. And for the urban authorities, that then creates a barrier, because they would like to only procure sensors that have gone through the certification process. So that is for sure a challenge when it comes to, like you mentioned, getting this data into the pipeline for policymaking. David, please.
Yeah, it could be interesting at some point to maybe see how it was done in other places, because today some official reference agencies use what we call local sensors to enhance their existing reference instruments. So maybe at some point it would be interesting, not just you trying to convince them, but also maybe have other reference agencies talk with them in like more collaborative approach to share best practices on how to do that. So not only just you would come with questions, but those people could come also with partly some answers. So that could be maybe a positive way of doing things. Because today some reference agencies are using local sensors. So it means that it's doable at some point.
Hola.
Indeed. Thomas, please.
Hi, yeah, just to say from the UNICEF procurement perspective, so I think air quality sensors may be a little bit off, but it is on the horizon. I think I mentioned that they're starting to at least workshop and look to do work to address exposure of children to poor air quality around the world. But from the current work I'm involved in on lead exposure, at least, these standards or ISOs were very important. If you had people proposing devices or lab services that didn't meet those ISOs, then they would then not be considered for technical scoring and therefore financial evaluation. But yeah, probably on the horizon when the air quality devices come up for procurement, this might be a different factor. But at least for established methods, that those standards definitely are important.
Thank you. Try to see if there was any more questions from the chat. I think they were all connected. Maybe if I can come back to Celia, to you, when you are working on supporting municipalities with urban planning to improve health, and you're integrating scientific evidence, and now you have also recently added this citizen engagement component to your tool, what would be your hypothesis about local authorities that you have worked with if it comes to integrating, for instance, data coming from citizen science projects and low-cost sensors, based on your experience?
Yes, so well, specifically, we have worked with sensors. Like the way we work with citizens is to do the analysis of the area in a more comprehensive way. So we look at several aspects of the urban environment. But I would say that data, either both scientific data and the citizen participation, the citizen experience, is super important for the municipalities, because one, they have figures and they have the arguments to know how to approach the future development or regeneration of an area. And then with this perspective, also they can prioritize actions, right? Because, well, many times we provide like strategic plans or like roadmaps for municipalities. And when we have this perspective, like more qualitative, municipalities know where to start, like which is the main priority, right? And which are these aspects like health indicators that need to be addressed more urgently in this context. So I think it all adds to the experience and the analysis, right?
Yeah, thank you so much. We had some question from also about the resourcing, that how to small to medium-sized cities with a very limited budgets, how can we practically access these kind of low-cost sensors? If there are affordable or grant-based options, equipment sharing schemes, or anything that could support smaller municipalities. Nothing that I personally am aware of. Again, I would like to call on my colleagues here from CitiObs. Yes, David?
Yeah, just one thing I think we have to be super careful is that when you're trying to evaluate your budget, buying the hardware should be no more than 30% of your budget, because buying the hardware is just the beginning of, if I may say, the problems of the work. Then you have to process the data. Of course, this takes resources and also communication, because if you collect that data and don't make value out of it, it's kind of too bad, because you've done all the hard work and don't share it with your target, with your audience. That's quite complicated. And also today, there are solutions out there on the market. You can get fairly decent sensors. Also, we have to be careful what we talk about sensors. Sensors is the sensitive part inside the device. So, but those equipment to measure air quality, you can get fairly decent stuff for around 300 euros. You can get, something that works out of the box. So it really depends on your budget. But again, save 30% for the hardware and all the rest for the rest.
Thank you. Very good point.
Maybe
Yeah, I think I just wanted to add something really similar, that often, we think about the sensors as being sort of the big investment, and increasingly what is happening, especially when smaller municipalities purchase sensors, is not necessarily having the full pipeline. So with some vendors, you might purchase the sensors, but then you also need subscriptions with them so you can access and use the data and analyze it. So as you're thinking about which sensors, or what kind or where to deploy them, definitely maybe talking to other municipalities who may have done this, or thinking through what that full life cycle for these sensors is going to look like, and allocating resources in relation to that is important. Some of the vendors do offer good ways for people to purchase these sensors and deploy them. And I'm not going to take names right now, because it doesn't, it is not right to endorse like specific vendors, but there are vendors out there who tend to be more open with, what types of instrumentation you're getting, what data, and how you can use the data, versus others who may have a more controlled process for how and in which ways you can access and utilize the data. So definitely keep that in mind as well.
Great, thank you. And I think, Nuria, you wanted also to highlight something, and please, if you want to open your microphone as well as sharing in the chat.
Yes, sure. I just shared in the chat that also we have this environmental monitoring toolkit that guides you also through the process of planning the monitoring campaign, and also has links to other useful resources, because as Pallavi, I think she was mentioning, like there are so many already existing resources, so you can use that to guide you.
Thank you. There was also a question in the chat about data pre and post low emission zones implemented in France. It's quite specific. I don't know if any of the, if Philip, you have any insights on this from your mapping exercises?
I'm not exactly sure when the low emission zones in France were in place, so this is maybe something that David can take.
Yeah, it was removed, and then I don't know exactly which part of the decision body, but say that it had to be done. So it was voted, then blocked, and then acted that it had to take place anyway. So we're right in the middle of nowhere. Oh. But it was stopped, and then it's back on track.
And we don't know about any specific monitoring of the pre and post situation in terms of air quality. Any studies that have been made on this?
No, today it's mainly, in France, it's structured around what we call the ASCA, which are official bodies, like associations that are paid to do that. So in France, it goes through those people that will deploy or not lookout sensors, but they're doing a great job. So I guess they will do what it takes.
Thank you. So we are almost at the end of the session here today. I really want to thank all of the speakers and all of the participants. We still are 44 people online, so I assume that this is a good sign that that triggered a lot of interest. Before we go, I would want to have a quick poll again on Slido, just to capture some of your key takeaways from this session today. So if you would like to share, what is your key takeaway from the discussions today? Let's see, one typing. Education, educate the children. Indeed. Collaboration is key and also sometimes difficult. So still some people typing. Leave this on for another little moment. Hope and optimism. That's a nice way to frame it. All right, gonna stop sharing a moment. You might see that still in your screens. So thank you so much. Just a few closing words to let you know how we have already shared a lot of links and ways to follow us in the chat, but I will be sending out a follow-up communication to all the participants with some relevant links and quick survey to ask how you've experienced the session here today and ways that we made improve them for the future. In the CitiObs, when it comes to policy engagement, we are developing 5 policy briefs highlighting different ways of improving the relationship between citizen observatories and policymakers. And a lot of what we have been discussing here today is something that we have already captured in some of these key messages. One key message, I think, for many policymakers is that we know the importance of the data and the quality of the data, but what we have also seen is the range of benefits that engaging in citizen science can entail. So it's about getting the data right, but also getting the participation and the education aspect of those initiatives right. And that means that you can ideally work on some co-benefits that are much broader than only having nice and tidy data at the end. But again, I want to just thank you for engaging in this session, and please do follow our updates. We are in the final year of the project, and there will be a lot of interesting news coming from our end. So you can follow us on LinkedIn and on the YouTube channel. This recording will be put up so you can access the information again. And of course, our website and our blog, where we will also write up a little recap of this session. So thank you all, and wish you a nice day ahead or evening, depending on where you are. And we hope to see you in a future event.